Jim Aiello knows that sometimes you don't get to call the shots. Still, the call he got some 20 years ago informing him that he had kidney disease took him by surprise.
We're going for life insurance, so they got to take all those blood tests, and that's how they found out. So we didn't get any life insurance.
Jim did get confirmation from several doctors, but no answer as to what the cause of his problem was, or the progression that the disease might take.
No symptoms, no nothing. Every 6 months I'd go and see the doctor and we'd do the blood tests and the weight and all that stuff. And this time he comes back and he says, I think you're going to have to go see a specialist because your kidneys are failing and I think it's time for a kidney transplant. So that's when we went to Beth, Israel.
Jim hoped to get a transplant before needing dialysis, a hope that Dr. Douglas Hanto, chief of transplantation at Beth Israel Deaconess Medical Center, shares for all his patients.
We think it's extremely important for patients with kidney failure to receive a kidney transplant before they start dialysis if possible, because the outcomes are much, much better if we can accomplish that. So our goal is to try to get patients transplanted before they finally end up on dialysis.
The Beth Israel Deaconess Transplant Center performs about 75 kidney transplants each year from both live and cadaver donors. One of their specialties, transplantation for the diabetic patient. The center is affiliated with the world-renowned Joslin Clinic and is home to dozens of clinical trials each year, giving patients access to the newest, most promising therapies available. They also take a true team approach to care.
At our transplant center, you can see a surgeon, a transplant nephrologist, a liver specialist, an infectious disease specialist, a transplant specialized nurse, social worker, dietitian, and we're all in the same place. We work together. We're a very coherent team. You
see one doctor after another, and it's all set, and I mean, you go from one stage to the next stage, and they talk you right through everything.
Jim had already talked with his 10 siblings. His older brother Chuck was one of several willing and suitable donors. However,
when I went for my last test, the CAT scan, they found a spot on one of mine. So we had to wait another month, and I had to go for an MRI. And I guess it was just a skin graft or something. So they gave it to him.
They laugh about it now, but there is a deeper gratitude and understanding in this family. Chuck and his wife Sandy lost their daughter Kayla to kidney cancer when she was just 5 years old.
I think about it every second, every day anyways. I still go up to the cemetery faithfully every morning, say a couple of prayers, so she was always in my mind. But I knew she was up there to help me out, not to hurt me, so it went pretty well.
With that kind of oversight and the care they received at the transplant center, so far, the results have been great.
Beth Israel, I thought, was an excellent hospital because they said we were supposed to be out of work like 4 to 8 weeks and this and that, and we were right back quick.
Well, I have a new kidney now. I know that it's working, and I know that I don't have to worry about that anymore.
Go ahead, Chuck.